Migrant workers will have access to more primary care clinics located closer to their dormitories from April 2027. Manpower Minister Tan Leng says this will allow them to get help faster when they are unwell and cause fewer disruptions to their work and rest routines. Nadirah Zaidi reports.
There was singing, there was dancing, and there were goodie bags, all for the 10,000 migrant workers gathered at the marquee downtown East to mark International Migrants Day. And there was more for them to celebrate, better access to affordable healthcare in the future. Manpower Minister Tan Leng announced plans to set up more clinics within 2 kilometers of workers' dormitories.
This means shorter travel times, quicker access to help when they are unwell, and it will also result in less disruptions to their work and their rest routines.
He added the change is based on feedback on how to improve the primary care plan. Under the plan started in 2022, migrant workers are enrolled with a medical service provider known as an anchor operator near where they live.
My friend is sick, but near no have drum. But they very sick. Need to go call the ambulance, come here, then go to the Tantosik or Alexander is very far. So more than this one, maybe accident. People can fatality accident. He can die also. If near dormitory, near have the clinic, we can go. This primary treatment there can people, our migrant brothers can be okay.
These operators include community clinics and dedicated migrant worker clinics within and around recreation centres and large dormitories. For S-Pass migrant workers in construction, marine shipyard or process sectors who don't live in dormitories and already have access to corporate healthcare, MOM says these workers can be excluded from the primary care plan. This is to avoid overlap from the current coverage. These will take effect from early 2026 and details will be announced closer to date. Clinics will also be grouped differently, with the current 6 zones reduced to 4: North, South, East and West.
With fewer but larger zones, the anchor operators can serve a much bigger pool of workers, achieve better economies of scale, and in turn keep the annual capitation rates reasonable for our employers. This reduction in zones will not compromise our workers' accessibility to care.
To strengthen social support, 2 groups of migrant worker volunteers and ambassadors will merge under one unified program next year. This will help MOM and Migrant Workers Centre reach more workers and use volunteers more effectively. A group of star ambassadors will also be identified to serve as role models in their communities.